guys, it's Andy, your new stroke coordinator. We're making this set of videos to emphasize what is expected of you as the ER nurse when doing a neuro check for our stroke patients and those who are getting TPA. Unlike other body systems, the most important thing when assessing a stroke is the neuro exam. Unlike other body systems, you can't do a test, a lab test to measure it. It really comes down to a neuro exam by the nurse or the provider. It is expected of ER nurses that when somebody presents having stroke symptoms, that they do perform an enhanced neuro exam within the first 15 minutes. After TPA administration or while waiting for TPA or thrombectomy, taking them to angio, it's also expected that you perform an enhanced neuro check every 15 minutes. If you were to pass off this patient to another nurse before completing their care and taking them to the ICU or to angio, best practice is that you and the other nurse that you're handing off to do a neuro exam together so that you can touch base and know exactly what the other person is talking about. Part of the enhanced neuro check is assessing the level of consciousness. If you're doing a good GCS though, you should already have a pretty good idea of which level of consciousness that they're doing. It's important to remember about a GCS that although we often associate it with traumas, that it is actually a very useful assessment when we're assessing a stroke patient. A few key points to remember is that the best is 15, the worst is 3, and that we are recording the best response. Stroke patients will often have unilateral deficits, and it's important to remember that no matter what the other side is doing, we are recording the best response. Another part of the neuro exam are the orientation questions. What we're looking for is person, place, time, situation. I used to think that person meant anybody if they could recognize anyone, like who the president is. But what it actually means is, do they recognize themselves? Do they know their own name? This is the last thing to go, and if that is gone, that is a troubling sign. The other ones are pretty self-explanatory. It's also important to remember that we're looking for acute changes from baseline, not where they are, the difference between where they normally are and where they are now. Speech and language. These are easily assessed as you're asking the orientation questions. Speech is looking for motor deficits, whether it's drooping of the face or problems with the tongue. Language is looking for either receptive aphasia or expressive aphasia. Ocular assessments. With EOMs, we're looking for the muscles that control the side-to-side and up and down movement of the eyes. So make sure that you're covering each of those quadrants as they're following your finger around. With visual cuts, this is a new addition that we need to be doing with each patient. And what you're looking for is visual cuts. The simple term is called homonymous hemenopsia. Homonymous hemenopsia. And because of the way that the cranial nerves give us our visual fields, you're looking for a cut that is on the left side in both eyes or on the right side in both eyes. And then with Pearl, I feel like we all know what that is. We're looking for the dilation of the pupils, and using the otoscope on the wall is a good trick to always have a light handy. What we're looking for with strength exams is unilateral aspects or changes from baseline. With the face has the most cranial nerves going to it, so what we can do is raise our eyebrows, close our eyes tight, blow up the cheeks, stick your tongue out, moving it side to side, and you want to look for a change from left and right. And it's the same thing with the extremities as well. Shoulders, arms, legs, testing all of those is key to doing a good neuro exam. Sensation and neglect. A trick that I like to do when I am assessing a patient for this, I like to have them close each of their eyes and touch each side of their body as I'm moving up, their legs, arms, torso, and face. It's also a great way to detect neglect. Neglect, if you remember, is when you stimulate each side of the body, and when you stimulate each side of the body independently, they can see or feel it, but when you stimulate them at the same time, that they only feel or see one side and they are neglecting the other side. So the first thing I'm going to look for is the level of consciousness, and I can see that Cooper is very much awake. Next, I'm going to ask orientation questions. What's your full name?
Kevin Cooper.
Do you know where we are? Where are we?
The hospital.
Why are we here?
Because we love healthcare.
We love healthcare.
Yes.
What day is it?
It is Thursday.
Thursday.
Yes.
Perfect. So he is alert and oriented times 4. Next, I'm going to check his eyes. Let me have you follow my fingertips with your eyes without moving your head. Perfect. Okay, that's all intact. Next, we're going to look for his visual fields. I want you to look right at my eyes and tell me how many fingers I'm holding up.
2, 1, 2, 1.
Perfect. Okay. Next, we're going to look for Pearl to see how his pupils are doing. He has a brisk reaction to light with 3 millimeter pupils. Next, we're going to check for strength, starting with the face. So can I squeeze your eyes really tight and open your eyes really wide? Perfect. Now I'm going to have you give me a big cheesy smile and then stick your tongue out and move it side to side. Perfect. Okay. Can you shrug your shoulders for me? That is all intact as face. So we're going to move down the body. Shrug your shoulders for me. Perfect. Squeeze my fingers. Okay, pull me towards you. Push me away. His grip and his strength is equal in both of his arms. Now we'll check for drift. Lift your hands up with your palms facing the ceiling and close your eyes and keep them there. Perfect. No drift. Next, we're going to check the strength of his legs and his feet. So I want you to push down with your feet and pull back up towards you. Now we're going to check for drifting and strength in his legs. Lift this leg up and don't let me push it down. Perfect. Now lift this leg up. Don't let me push it down. Okay, excellent. Now we're going to check for sensation, and at the same time we're checking for neglect. I want you to close your eyes and tell me if I'm touching left or right or both.
Okay. Both.
Now we're checking
Both.
each of the cranial nerves on his face.
Both.
All right. So he has completely intact sensations, and he has a completely intact neurological exam. Wrapping it all up, I hope that this is a video that you can use and refer to if you ever have any questions about strokes or neurological exams. In the emergency department, we are the first line, and often we as the nurses are the first to perform a neurological exam and to detect if something is wrong. It's important that we have a comprehensive and accurate exam as we're reporting to our own doctors and to the neurologist. We are a comprehensive stroke center, and by doing the best exams possible, we will help each of our patients to have the best outcomes possible. If you have any questions at all, I love talking about strokes, so come and find me with ideas or questions or anything that you want to talk about.